Welcome back. Are you looking for some solutions to possibly missing teeth or unhealthy teeth? It's time of the essence.
Joining us once again, this guy, Dr. Richard Aguila. He is back to talk about all of this and a lot more and something called hybrids. Dr. Aguila, it's so good to see you.
Great to be back.
Okay, so let's talk about this. You say there are a lot of advertisements out there for people who can transform a smile, you say, in a day. But you say, is that really possible?
Yeah. In today's society of immediacy or immediate gratification, there's been a ploy that's come to fruition in advertising that promises, teeth in a day, teeth in 24 hours. The truth is, any ethical dentist will provide you with replacement teeth if they remove teeth. I mean, if you're an ethical dentist, you will provide replacement teeth. The question is it the permanent set of teeth, permanent replacement, or is it a temporary replacement? And then is it a removable replacement versus a fixed replacement? And to make a blanket statement that everyone gets teeth in a day is quite untrue. It can be done, but not necessarily all the time. At our office, we basically do what's best for the patient. If it entails getting permanent teeth early and we feel it's going to be predictable, we do that, okay? As long as there are no compromises. If there's a lot of infection, if the implants don't go in stable, it might be best to have a removable temporary set of teeth that allows the proper healing to occur and allows to get a more ideal outcome. So we don't make a blanket statement saying that all patients get permanent teeth in 24 hours. We kind of do what's best for the patient.
Yeah, so it's a little misleading to say teeth in a day. So let's talk about that. I know each case is different because everybody's mouth is unique and different. But what is the ballpark time frame to get a full mouth replacement? For
full mouth extraction with replacement with implants, with technology today, things are happening much quicker. So that certainly is true. Okay. In the past, it would take anywhere from 12 to 18 months. Now, with our hybrid protocol and the technology available, we can get the permanent set of teeth completed as little as 7 to 10 days to as long as 16 weeks. So it depends on the case. So anywhere from a week to 16 weeks is what we tell patients. Okay, and for those patients that don't like wearing a removable temporary, we do have something called Hybrid Express, where we actually make a temporary set of teeth that actually get screwed onto the implants, either the day of surgery or a few days later. And the nice thing about having a temporary set of teeth, it allows the healing process to occur. If there are any changes in the gum tissue, any changes in the bone that occur, we can still correct that because we still have to go to the final prosthesis, okay? So there are things that we can do to make that transition for patients, from teeth to implants and permanent teeth a lot easier for them.
What questions should people be asking that they might not be thinking about that you recommend that they do so upon seeing someone such as yourself?
Correct. Whenever we're doing full arch, the questions they should ask themselves and ask their dentist is what arch is it? Is it the top arch? Is it the lower arch? Typically for the lower arch, things can happen much quicker. The bone is much denser. We tend to get a lot more predictable healing in the lower arch. And those are on the lower arch, we typically can do that, as early as, 7 days from start to finish, okay? We also have to take into account, are there teeth present or not? If the teeth are already absent, we can certainly matriculate to a permanent prosthesis sooner rather than later. Whereas if we have to take the teeth out and place the implants, they may not go in as stable, okay? Where we may have to wait a little bit longer. And you may want to ask if do you want to go through additional appointments and additional expense in order to wear a fixed temporary? Oftentimes, if you're only waiting, 1 to 2 weeks, or 16 weeks even, to wear a removable temporary, it's not that big of inconvenience for patients. So those are questions you may want to ask your dentist before moving forward with full arch treatment.
Yeah, there's always a lot of questions that come out of this, and we obviously can't cover all of it in this segment. So what is the best way? You have a seminar that people can come to once a month. That's really the best way for them to get a lot of their questions answered, right?
That really is. It's an educational seminar. We hold it on the third Wednesday of the month. Our next one is actually on July 19th. We talk about dental implants. We talk about other services that we provide. We answer all your questions, and from that seminar, you're granted a complimentary consultation.
Okay, good to see you.
Appreciate
Thank
it.
you for being
Thanks for having
here.
me.
And we'd like to thank Jacksonville Dental Specialists for sponsoring the segment. You can call 904-460-4201 to schedule a consultation. You can also visit their website to learn more, which is jacksonvillehighbridge.com. Well, still to come, Rona Brindley.